All right. All right, you should be able to see my slides. As usual, this is for school and health department staff. We will post the slides and the recording on our website later this week or early next week. Make sure you pass along information to those who need it. I just wanted to share a study that was brought to my attention by a colleague this week. I know early in the Omicron outbreak, there were concerns that the rapid antigen testing and the at-home testing might not be detecting the Omicron variant, but this study was done as part of the NIH's Test Us at Home study and project, and it did detect that the at-home tests, which were primarily the Binax Now kit, so essentially what you use in the schools and other tests like that, worked just as well as the PCR test to pick up the Omicron variant as well as the Delta variant, and actually was picking it up a little bit better with the Omicron variant. And any concerns about sensitivity found that, in those that were negative, if they did serial testing, so if they tested again in a couple of days, they increased the sensitivity of the testing. So I just wanted to share that to show, that those concerns actually were not really founded. Then I'm going to share a few slides on Friday. I'm sure you're all aware, and we did get emails out as soon as possible. I believe for pretty much everybody, we got them out on Friday, trying to update the guidance the CDC has shared about community levels of COVID and how they're using that to recommend prevention strategies. These are slides from their discussion with us on that and kind of sharing their rationale for those changes, just a few of those slides. So they're basically discussing that, now we have much more immunity in our communities. We have other tools. We have availability of masks. We have medications. We have more testing. So really adding in some other variables besides just how much COVID is in our community, how much positivity is in our community, to try to give us an idea of what is the impact of COVID. So they're adding in variables looking at the hospitalization rates and numbers due to COVID in our communities, to give us an idea of how severe is COVID disease, what's the burden on our healthcare system, how well are we protecting our vulnerable populations. So just as a review, they mentioned that the indicators that we're using now from the CDC were developed about a year and a half ago, and that was before we had vaccines. It really doesn't give an indicator of how severe the predominant variant is. So as with Omicron, it was felt that it wasn't causing a severe illness. And so the absolute rates didn't really give us an understanding as to how severe it was and how much hospitalization it was causing, for instance. So the way they calculate these indicators, this may be more information than you ever wanted to know, but they do still factor in, to some extent, the amount of cases. So if there are fewer than 200 cases per 100,000 per week, then they look at a bit on the higher end of hospitalization rates. So basically, they're looking at the rate of new hospitalization admissions over a 7-day average for that area, that community, and how many of the open available beds in a hospital are being occupied by COVID patients. If there are more cases in the community, they have a little bit lower threshold. So basically, it just kind of weights the community cases a little bit higher, which I think is realistic because when you get more and more cases, you get more spread. And if you get more people sick, inevitably you're going to end up with more deaths or more hospitalizations eventually. So, because there are concerns with some people in the healthcare community that hospitalizations take a little time to catch up with illness. So that's just the difference there, is that again, there's just a little lower threshold. So again, like these numbers here are the same as the low numbers up here for the lower case rates. So again, just giving a little more weight to the rates. So their considerations are, vaccinations are main prevention technique. People that are vaccinated will have a lower risk of severe illness and hospitalization. When people are making their individual decisions and, we at Public Health are making community decisions, we should consider the community level, but we should also consider health equity and other information that's available to us. And, layered prevention strategies are important, not just one prevention technique. So they showed slides like these. They gave us an idea of the difference that this will make. On the left, this is what the country looked like at the time of their talk. Mostly red. This on the right was how the country looked with the new community levels. So just showing that it did give a much more variable look to our counties, giving a much kind of lifting the burden off a lot of areas, because even though we still had pretty high transmission rates per their old definitions, we have had a big reduction in the burden of our healthcare system overall. And I just wanted to point out, for our healthcare prevention measures, we still do use these values on the left. So when we in the healthcare world have to decide on what preventative measures we use, what kind of PPE we have to use, we still do use these red, yellow, orange, blue colors. So these don't go away completely. So I just wanted to point that out, that you can still find these indicators on their website. So they just put here some more information that with the old measurements, or again, they're not necessarily old, they're still in use, but about 70% of the country was still in the high transmission, whereas now it's about 1/3 in each of the categories. So again, their point is that it just seems to make a little more sense and be a little more realistic with what is going on in the country. This is very busy, so don't freak out. I know this looks really busy, but I wanted to give you all of the information that they have. They have some simplified tables, but I minimized in these tables here. This itty bitty type is what's up in the prior box, and same here in the high. This itty bitty type is the same that's up in the medium box. So when you're at low level, they recommend that you keep up to date with your vaccines, you keep your areas well ventilated, you still follow the recommendations for isolation and quarantine, and you get tested if you're exposed, even if you don't have symptoms. And if you're immunocompromised or high risk, you have a plan to get tested right away. Consider even having tests at home, and make sure you know if you are a candidate for getting treated. If you're sick, having post-exposure or pre-exposure prophylaxis. There are some monoclonal antibodies that people that have a bad immune system can get regularly as pre-exposure prophylaxis, and other things. So that's what they recommend if you're at low. I'm not really going to go through the community level that much, but that information is there. Then as we get into medium, which most of us are at, they recommend additionally that if you're immunocompromised or high risk, that you talk to your healthcare provider. If you should also add on a mask, that if someone in your household or your social contacts are at high risk for severe disease, you consider testing yourself before you visit them or spend time with them, that you consider wearing a mask when you do visit them. And then when we get into the high risk areas, in addition to all of these things up above, that they do recommend then that you wear a mask whenever you're indoors in public, regardless of your vaccination status. And that then does include the K through 12 settings. Otherwise, in the medium and low settings, they don't recommend universal masking anymore in the K through 12. And they recommend if you are immunocompromised or at high risk for severe disease that you wear a mask or respirator. So they recommend going up to a respirator, not just a mask, to give you better protection, and you even consider avoiding non-essential activities in the public at that point. So that's kind of how their color scheme works. Also on Friday, and we shared this on Friday as well, but the CDC, who is the organization that made or has the standing order to have masking on public transportation, on Friday, the CDC changed their enforcement to not require people wear masks, so not require that they wear masks on buses or vans operated by school systems, early care, child care programs. So they're making it align with the guidelines I just discussed. So essentially, if you're in the high community levels, it's recommended that people wear masks on school bus or school transportation, but it's no longer required. So this data is being updated once a week because that is how often our hospital systems are required to submit it, although they typically submit it much more frequently. It was updated on Thursday. Again, it was first public on Friday. I just checked before coming onto this call. It still is not updated yet. So my hunch is it will probably be updated sometime today, but we'll have to watch. But again, it's just updated once a week, so you don't have to check it really often. But at that time, we just had 3 counties in our area that were in the high, or 4 counties in our area that were in the high status, and the rest were in the medium. On that web page, there is also a spot you can click to download data table. You'll get every county in the entire country. I sifted out our 19 counties, and this is the data that you will get. So it'll tell you what your community level is. It'll tell you what percentage of your hospital beds are being occupied by COVID positive, how many people per 100,000 of your population are being admitted for COVID, and then your cases, your positivity rate. So, and then your kind of your old classification for COVID. Now, all of the hospitalization data does seem quite unique for each county. It is a bit unclear to me how they siphon it down per county. Obviously, everyone who's admitted, they enter in their zip code of their residence. So that question was asked on the CDC call and was answered. And, I'm not 100% clear how their epidemiologists figured that all out, but I'm assuming that they report it by zip code, just how we do like with vaccinations and everything else, rather than, by the hospital or by the county. It's more by, the area that they live. But just a reminder, regardless of what your county ranking is, that 5 days after quarantine and after isolation, you're still supposed to be wearing a mask because, again, you can still be contagious. And when you're around others in your home for the days 1 through 5, you're supposed to still be wearing your mask because you definitely can be contagious. So I put the link here for that CDC map, and then the My Start map is still how it used to look. They are working on updating it to get it to align with how the new community or county transmission looks. So that should be coming. The data and modeling update from the state. First, I did put in an extra slide here. This is the cases in the United States. Kind of slowing down on our decrease, but still definitely decreased overall. In the state, our percent positivity on average is 7.2%. Our cases are 120 per million, and our hospitalization rate is 6.6%. So still down, still decreasing. The age rates, still young adults, but it's so squished up here at the end, it is really hard to know. So basically everyone is down. Hospitalization numbers, again, continue to decrease, still above our lowest points, but getting there. Same with our ICU census throughout the state. But only 229 people in the ICU in the state for COVID. That's a big improvement. Our childhood hospitalizations for COVID are about half of what they were, still not zero. So, anything more than zero is sad for me, but getting there. The variants of concern, just to point out, I don't want to be a gloomy Gus, I guess, but this Omicron subvariant is at 8.3% in the nation. This is last week's slide. It was 3.8 the week prior. So 2 to 3 times higher than it was. Hopefully it will not take over, as there's some claims it's a bit more contagious, but we hopefully will not see that happen. We're not seeing any of it in Michigan yet. So I just wanted to kind of give you that comparison. So that is all that I have. Let me stop sharing, and then I will get to the chat. If you guys have any questions, just put something in the chat. And after that, we'll open up to any calls or any questions you want to ask on your phone. Some are able to, okay. Has there been any talk about considering population density for the equation? Yeah, and they try to, I know Port Aranac has, very low population, and, you add 1 or 2 people in there and it makes it seem high. They try to correct for that with the rates. So we do a calculation where we take the number divided by your population and then multiply either by 100,000 or 1 million to try to give it your case rate per certain standardized population. So that's our way of trying to equalize it. So, again, it still does seem like, if you have a few cases in a small population, it still does end up seeming like a lot. But again, those rates are where we try to even that out. And again, with the hospitalizations, they are looking at rate and percentages. Again, trying to do the same thing, but I'm hoping that once this new data comes out, which hopefully will be today, I'm hoping that for our counties that we're still high, we'll see enough improvement that things will come down. Do you feel building entry protocols are still necessary? I'm not sure what you mean by building entry protocols, but there's really not been a recommendation for any screening at the door ever. So I'm not quite sure if you're doing that or not. If if you want to be more specific, but it's never been recommended that you do screenings at the door, more that people self-screen at home. But at this point, if you are having people doing symptom screenings at home where they have to do it on a database or, enter it into a log or something, those are not required. And many are getting away from that just simply because, most people just aren't really putting much thought into it anymore. It's just kind of white noise now. So again, none of that is required. Most of it's not recommended specifically. It's just encouraged that people self-monitor for symptoms. So if that didn't answer your question, you can clarify. So contact tracing, and so do you still recommend contact tracing and test to stay? So there are some modifications we're trying to work on with the state. And if not the state, we may just make some changes on our own. We're trying to focus more on higher risk individuals. But there will be some focus still on test to stay and some minimal contact tracing for higher risk individuals. But we're hoping to get better information out to you. I'm hoping before next Thursday so that we can discuss it next Thursday. But the utility of that, as you all know, is getting to be less and less valuable. Are we to report positive cases to the health department? I know there's talk on the news about this becoming more of a seasonal illness, so I wonder if the reporting requirement will change. So COVID is still a reportable illness per the public health code, and it is still required that you report it within 24 hours, just as you would chickenpox or whooping cough or any of those illnesses. So you are still legally obligated to report it. If you want to just save up names and email or fax them once a day, and then over the weekends, I don't know that any of us really feel, if you find out Saturday, just tell us on Monday. But yeah, you are legally required still to report that. Any other questions? You can put those in the chat or just unmute and ask.
Dr. Morse, I have one more question.
Yeah.
It's regarding bus drivers specifically. So the CDC memo, it seemed to be, maybe I'm misunderstanding, but do the drivers themselves have to continue to maintain mask wearing as a driver of the conveyance for public transportation?
No, the way I read it is that anyone on a school bus is not required to wear a mask. They should follow the recommendations based on the county levels.
Okay, thank you.
I don't know if anyone else read that differently, but that's how I interpreted it, whether it was driver or staff or student. Any other questions? Wow, you guys are easy today. As usual, we'll get slides and recordings out to you and posted on our website. And if you have any questions or concerns in the meantime, let us know. And if any other last minute breaking news comes along, we'll try to get it out to you as soon as possible. So have a good rest of your week and a good weekend, and we'll talk again next Thursday.